Good afternoon, everyone, and welcome to Edinburgh on a sunny day. Now, if you know anything about Winnipeg, where our guests are from, Inaugural and Roos, you'll know that there is a lot of sun there. But when they first arrived 41 years ago from their homes in Norlu's case, Oregon, and Les's case, California, it must have seemed a rather harsh climate despite the sun, because on the average winter day, it's not infrequently that unique temperature which is the same in both Celsius and Fahrenheit, minus 40. And yet, they stayed, they prospered. And I think from our point of view, the most interesting thing is that they created the longest population-based, I think, continuous in time database for a complete population of a whole jurisdiction, the province of Manitoba, that I know of in the world. Many of the data sets going back well over 30 years. And in that process, they had to pioneer not only solutions to technical problems, some of which I know Les is going to deal with, but they had to also deal with the challenges of keeping funding moving in their direction, because they hired and trained all kinds of sophisticated people, like many of the people in this room. And they'll describe, I hope, a little bit about how they approached that, because the model is not quite the same as the model that we are engaged in, that is, of course, a grant model. And they'll, I hope, tell you a little bit about their model. Not that we need to change our model, but we might want to have a few tricks in our back pocket for the future. I'm going to start by introducing Les. He's a distinguished professor in the Faculty of Medicine at the University of Manitoba, with Roos, as I said, founding co-director of the Manitoba Centre for Health Policy. He's very highly cited indeed. And his interest is in all of the opportunities that information-rich environments like the Manitoba Centre for Health Policy afford a wide range of decision makers, whether they're clinical or health system management, or indeed policy and program decision makers in other sectors, something we'll hear quite a bit about today. He's a fellow of the Canadian Academy of Health Sciences and a member of the Academy of Sciences of the Royal Society of Canada. And I know him and Nora Lou through a long association with Fraser Mustard's Canadian Institute for Advanced Research Population Health Program. And so with no further ado, Les is going to speak to us about an information-rich environment, opportunities and challenges for the next generation. Les?
Thank you very much, John. One of the features of our work is a lot of collaboration and a real effort to build satisfactory career opportunities for our technical people. So a number of the co-authors of the presentation today are our staff members, and since they had, in connection with the International Health Data Linkage Network conference a couple of weeks ago, presented some very nice posters, I brought them with me, and they're down in the entranceway. And for people who want details, I would encourage them to take a look at the posters. And I also said if I had any hostile questions from the environment, I would refer them to the posters, whether or not the information was available there. But we are dependent on long-term staff. And with regard to what John has said, we have had an interesting efforts to maintain our staff, to incorporate them into our trainee program, and then sometimes to maintain our staff after they have these higher degrees and private and public sector companies come calling on them. So I will just briefly mention the Center for Health Policy. You'll see our geographic physical location, what we're trying to do, and you also notice the health marketing framework of the Center for Health Policy. And this is very good in terms of much of our funding comes from the health sector, It's bad in terms of we are now the beneficiaries of cooperation from 5 ministries. And our Dean of Medicine was kind of blown away when we would have a meeting and 5 deputy ministers would show up, and he kind of muttered, "I can't even get the Deputy Minister of Health to talk to me. How come you guys could do this?" So we've been really fortunate in having the buy-in of the ministers and deputy ministers in our province. And a lot of the credit for that goes to Nora Liu and to Pat Martins, who's with excellent skills in building links to the funding sector, or to the group in our province which provides, I think about 60% of our funding comes provincially from these 5 ministers, most of which comes from health, and in return we have to deliver 4 or 5 products each year to them. So this is where John mentioned we get a little bit away from the federal grant funding, which we also try as much as possible to get federal grants, but we were fortunate in getting some sustained funding at the provincial level. This is our data repository, an overview. People now refer to it as the sun and the planets diagram. And you see this centrality of the registry. I'm not sure it should be called a health registry because it gives information essentially on every provincial resident, with the exception of the RCMP, the Royal Canadian Mounted Police, and some federal prison inmates are not included in the registry. Everybody else is supposed to be in the registry, and it's about 1.15 million a year is the provincial population, and it goes back to 1970. So you can see the terrific resource which it provides for longitudinal research, and that's why it's right in the center. The data include arrival or birth information, departure or death information, place of residence updated every 6 months, family information updated every 6 months, and I'm going to talk about some of the issues with the family information. And it gives you a sense of both the tremendous resource and the tremendous challenges which you get when a decision somewhere else in the bureaucracy about how they're collecting data impacts, and we don't find out about it for a year or two, and suddenly say, "Why do you do that?" That's what I say. Nora Liu and Pat are much more tactful. But it creates issues when decisions made relatively far away come back to haunt you. The first files we dealt with that we had were the hospital and the medical services on the 2 left and right of the registry there. And the additional files we've added over time with different start dates for each one. The hospital and medical go back to 1970 as well. Then the special files are outside the planets there. But you can see we have income assistance, justice data is just coming in, education data was a very important, relatively early acquisition to the data sets and so forth. Cancer care, special relationships have been negotiated with cancer researchers. Census data is, I'm just going to say, the only material here which is not individually linkable. And we're using the smallest possible areas from the census. Everything else is individually linkable here. And at the current time, the linkages are performed at Manitoba Health. For a number of years, we did the linkages ourselves, and they decided to increase security. We only get back a encrypted identifier. So the identifier I carry around in my Manitoba health card is not the identifier which comes back to the research center. And we developed our own record linkage program in SAS, which I'll come back to. And it's the Toyota, maybe, of record linkage, not much, the Toyota Corolla, not much glamour, but gets you there. And it only took us a week or two to develop. And that was one of our initial kind of breakthroughs. Statistics Canada had one there they charged $150,000 for, and we had a visitor who, in retrospect, I'm not being very quick, she was from Winnipeg and she came by and gave us a lecture, and I guess she realized when she gave us the lecture that she was really telling us how to subvert the Statistics Canada program, because she presented the formulas, and we have some bright session, and she kept talking, and I kept saying, we can do this, we can do that, 2 weeks. So we did have that kind of help from Statistics Canada. And Manitoba Health now uses the record linkage program with technical support from some of our very bright programmers, because these data sets can come in weird and wonderful ways. The people in charge of working with them talk about sometimes it's $100,000 for the first year when you get in a data set from some other agency, mostly government agencies, that have been collected over different time periods many years ago. They didn't use identifier, what's that? We always use the person's name. Well, we're not allowed to see person's name, so it goes to Manitoba Health, and they use the record linkage process to link. First, they link the name and say date of birth to the population registry, which they have, and then they assign an encrypted FIN to us. And after getting rid of all the incriminating fields, they send it back to us. So that's the way our process works here. Those boxes on the right-hand side are researcher-supplied data sets. The education ones, the various different kinds of educational data sets. The Healthy Child Manitoba is a very neat institution where it was put together to bring in the same 5 ministers, to get them talking to each other at the provincial level and discussing issues of policy and of data. So they've done some of their own surveys, which we have access to. And then the clinical data sets, one of the ongoing issues, which also the province is quite concerned with now for privacy reasons, is trying to standardize the clinical data so somebody knows about it as step number one. For privacy reasons and with data sticks, they're very worried about some physician that has 300 cases, particularly now with genome research and everything going on about security purposes. So we've been working there, getting access to the ICU data, the fetal alcohol syndrome data, and pediatric diabetes data sets. And there will be more of that type coming in the future. Now, what can we use these data for? Well, I started with our colleague Marnie Brownell generated this slide to look at some of the data sets that at different stages of life that can be used for research purposes.